All right, hi guys. So I'm here to give you group eval feedback. I'm sorry it looks a little janky, but Kaltura is not working and no one can seem to fix it. So I wanted to give y'all feedback. I'm gonna give you general feedback on this blank doc, and then I'll make 2 separate videos for specific eval feedback. So let's dive in. Most of you guys got date of eval, patient name, age, gender, date of birth, diagnosis, reason for referral. So in this section, you want to write, why are they being referred to OT? So something like, write total hip replacement, 1 day post-op, resulting in decreased ability to complete ADLs, or a new onset of inability to complete the ADLs post-surgery. Something to show why they need to be seen for OT. So this first section is subjective. So you need to keep that into account when you are writing it. So subjective, meaning it's going to come from your client. Yes, you can put in things that you know, but you really need to base it on your client and what they're saying. So something like, as per patient report, client fell while rollerblading and fractured right hip. Something where it's coming from the client. Client complained of pain in right hip. It's subjective, so it should not be medical jargon that you get from a medical record. That could be placed somewhere else, but in the subjective area is not appropriate. So past medical history, most of you did well in this section. We move down into social history and living. You want to be sure that you're including everything and making sure it's accurate. So she's not retired. She actually still works, but she's unable to work right now because of the injury. So that'd be huge to make sure you put there. Prior level of function here, you want to write that she was independent in all of her ADLs. And make sure that, again, that's accurate. She's 40 years old. Her children are 8 and 12. The client was cooking meals. The client was independent. Not that her children were helping her. So just be sure this is accurate information. Current level of function. So we gave you an option. You could just write C attached from under evaluation objective. But if you do choose to fill this section out, again, it's subjective. So you should say patient states X, Y, and Z. Maybe patient is aware that they're not able to dress themselves. So maybe the patient says, I'm unable to put my socks on, or I'm unable to get up and go to the bathroom because of pain. You could write that there. You want it to be objective here. Never ever write in this section or in any other section that the patient is having difficulty doing something that you didn't see. So an example would be, patient is unable to complete functional mobility going upstairs. We didn't test her going up and downstairs, so we cannot say that. We could say that the patient doesn't think she can do it, but we didn't see it, so we don't need to write that in our observation, okay, for the subjective section. So moving on to patient's goals. Yep, just writing exactly that. What does the patient want to do, and how, what's their goal while they're here, okay? Hand dominance, good job. Most of you got that fine. Posture. You want to make sure that you're not just saying posture is sufficient, posture is good. You want to write, that the patient had good or fair sitting balance on edge of bed with no upper body support, okay? Or did they have bilateral upper body support? So for this client, she was sitting in the bed most of the time with her arms outstretched behind her, supporting her. Now, could she sit on edge of bed without support? Yes, but primarily that's how she sat and kind of slumped over. So you want to explain that. Standing posture. Was she a wide base of support? Did she hold on with one arm or 2 arms? You need to be very specific, because if you just say it's good, then there's no reason that we should be working on it in therapy. When you scroll down into that observation, really explaining what do you see, what are you observing, and highlighting anything that's abnormal in this section. Most of you guys did well and were able to complete pain. All right, so we talked about after pain, but before assessments, putting in like a FIM or just listing out dressing mod or whatever she was. Okay, the reason that's important is if you don't put any of those things, if you don't put any ADL observations or you don't put any standing or sitting balance observations, then it looks like you didn't assess those or look at those in your evaluation, and you can't address those. And it just looks like you're just saying that they have this as a problem list versus you tested it, evaluated it, and assessed it. So you really have to make sure you document those. Okay, when you get into the assessment section, good job putting the Barthel, the short blessed. You need to make sure to MMT you put the scoring, and if you didn't score something in MMT, explain why, weight bearing restrictions, or what was the reason for that. Okay, and then you could list your balance, your coordination as well under there, if you didn't want to put it where you put the dressing and ADL section. All right, so problem list, you want to make sure you list every problem. I think that overall you did well, but just don't forget about endurance. That was huge. She needed a lot of rest breaks. Lower body strength was weakened or not tested. And then you want to also make sure you're addressing balance, because her balance wasn't great. She's now using an assistive device and she wasn't before. So you want to be sure to write that. When we get down to the assessment summary, clinical impression and recommendations. In this section, it's your time as an OT to shine and explain what you found via your eval, your clinical observations, assessments, and why the patient needs OT and what you recommend. Explaining therapist going to get clothes, etc. is a treatment note. So don't write, specifics of what occurred in your treatment or your eval, but highlighting what was wrong and how you're going to fix it. So an example, patient has decreased endurance, functional mobility, functional transfers, and balance. Patient has inconsistent compliance with hip precautions, presents safety concerns during lower body dressing, toileting, and potential problems when showering. This affects patient's ability to be safe with independence and ADLs. Patient presents with normal bilateral upper extremity strength. Bilateral upper extremity active range of motion is within functional limits, which is beneficial to learn adaptive techniques for self-care and functional mobility and transfers. Patient would benefit from skilled occupational therapy to decrease pain, increase safety, endurance, and dynamic standing and sitting balance to improve independence in ADLs such as toileting, shower, dressing, and IADLs such as home management and caregiver of children. Okay. Your plan, good job. Just make sure it's accurate, right? So acute care, this lady is high level and in acute, so she's more than likely only going to be in acute for a few days. You don't want to set out 2 weeks because that's not realistic, okay? As far as goals, I'll get into more specifics. It's mainly for wording for you guys, but overall you are hitting the goals appropriately. Just need to work on some wording and the ability. So then when we go down into rehab potential, she was excellent. And then you want to just explain why. Most of you highlighted that. So for her, she's a young, her age, she's young. She has a high prior level of function. She's motivated. She has a good support system. All of those are good reasons to list. So overall, you guys did well. So now I will go over each eval group in a different video.